eradication in the context of poverty eradication and social development. And we really want youth to make a change in this topic. It is amazing that so many of you have came here today and are joining online, which really shows the interest and importance of this topic. My name is Flora. I am a UN youth delegate from Switzerland, and I would like to thank the sponsors of this event, the Permanent Mission of Switzerland to the United Nations and the Permanent Mission of Germany to the United Nations for their support. A huge thank you also goes to the co-organizers, Ilka Essig and Lev Töpfer, who are the UN youth delegates from Germany and supported the organization of this event very much. Also, I would like to welcome Ana Maria Lazaruk. She is the UN youth delegate from Romania, and I would like to briefly introduce her before I give the word to her. She is an expert in the topics we are discussing today. She's studying clinical psychology, and currently she's working as a psycho-oncologist in a pediatric hospital. She's also an entrepreneur, and her company focuses on medical and psychological education for better management of chronic disease within the general population. And I'm very happy and grateful that we can co-moderate this event today. Ana Maria, you have the word.
Thank you so much. Thank you, everyone. It's such a pleasure to be here in this room with everybody. It's been a delight working with Flora and with the youth delegates from Germany. And today, the time is short for this complex subject that we are tackling, but still we will find ways with the contribution for our experts that we will be having today, we will manage to find some good practices and to get back home with knowledgeable information and with concrete directions after this event. So in the first part, we will have some inputs from our experts. We will guide them through some questions that we have been collecting during our organizing event from participants, from studies that we have been looking for in order to create a base for this event. And in the second part, it will be a bit more interactive. Both the people joining in person and online will have the chance to ask questions and to contribute. And we will be using the Mentimeter platform for this. So let's try to see if it works. I invite the people from online to join menti.com and to use the code that I hope you are seeing it online, which is, if I'm not mistaken, 8217. Oh my God, my site is not so good. 8875, right? So please, we are very curious to find out where are you joining from right now? What part of this world? So please, we are waiting for your responses. And in case we see responses on the screen, it means it works. Oh, perfect, right. So Germany, New York, oh, amazing. Oh, Romania also. Brazil, amazing. Okay, we will be waiting for a few more seconds, and then we will be moving forward. We're so happy to have many people connected online, and we will definitely give you the space also in the second part to join, ask questions, and make comments. So thank you. I get back to Flora now.
Thank you so much, Ana Maria, for introducing the event and setting the agenda. I would like to proceed with presenting our distinguished experts for today. And I would like to start with Alexandra Trant. Alex is an expert in global health, international affairs, and human rights, and she currently serves as the UNFPA project manager for the Lancet Commission on the 21st Century Global Threats to Health. And she brings extensive experience to her role, also in supporting youth delegates previously. Having completed her studies in Ireland and in the US, she has also previously contributed her expertise to various organizations, including the ILO, the UN Foundation, and UNESCAP. So a warm welcome from our side, Alexandra. Next, I would like to introduce Nazneen Damji. She is an expert in gender equality, women's rights and health, with a focus on sexual and reproductive health and rights. And she possesses specific expertise on developmental topics, including the socioeconomic impact of HIV and AIDS. And she currently serves as policy advisor for gender equality, HIV and health at UN Women. And last but not least, I would like to introduce Sajida Amin. She's a senior associate at the Population Council, where she leads the work on livelihood for adolescent girls. She's a sociologist and a demographer with decades of experience in generating evidence on empowerment programs for girls and women. She also studies the role of work opportunities in girls' and women's lives, and she's an expert in microfinance, financial literacy, prevention of child marriage, girls' and women's factory work and time use patterns, and the provision of incentives in the education sector. So welcome, Sajida. Now we move again to our online participants, and we could also have, please move to the next slide. We could also have contributions from the participants here. We want to make this really, really interactive. So please tell us, what is the first word that comes to your mind when you think about this intersection of healthcare and poverty? So really the intersection of SDG 1 and SDG 3. And feel free to raise your hand also in the room and just say a word.
Local communities?
Great. Thank you so much for all the contributions and also responses through Menti. And I feel like this really shows how important this intersection is for youth, and how youth can also contribute to change and improving healthcare. Exactly. So with that, I would like to hand back over to Ami.
Thank you, Flora. Thank you, everyone, for contributing. The next question is for our distinguished speakers. We are very curious to find out, in your opinion and from your expertise so far and your experience, what are the systematic barriers when it comes to the access of young people from different communities to access healthcare programs and services? What do you think comes in the way for them to benefit from a very good healthcare system? Thank you. And who'd like to start, feel free. Yes, thank you.
Great, thank you so much for that question. I think immediately I will qualify my response by saying that because of what I focus on, I'm going to concentrate on what's happening to women and girls in particular, and to talk about some of the barriers when it comes to gender inequality. But I have to say that we also need to be using a bit of an intersectional approach even there, because factors such as race, sexuality, age, migration status, ability, all impact as well in terms of how barriers are experienced. So for me, I think one of the big barriers is sociocultural. When it comes to how people face illness, there's inequalities right there when it comes to facing illness, how it's experienced, and then how you reach out and access services. I think women and girls are shortchanged in the amount of decision-making power they have on their bodies, on their decision-making in households, in communities. So those become barriers to basically seeking out services. I think economic barriers, as we are talking about poverty, economic barriers are very, very significant as well. So I think that would be a second area. It's currently 10.3% of women globally live in extreme poverty. That's the latest data we have. And we know that poverty affects marriage, early and forced child marriage. It limits people's access to services. And then even when they're going into clinics, you need to be able to access, you need money to be able to pay for diagnostics, for treatment, etc. So economic barriers are huge. Geographical barriers, we don't think about that, but remote communities, rural communities, they have additional barriers in seeking services. So clinics have to be closer to them. And then when it comes to women, they have this unpaid care burden in the household where they're not able to leave the house because of responsibilities in the home. And therefore, if clinics are closer to them, it becomes a little bit easier to do that. I'll stop there. Thanks.
Thank you very much for your input. Thank you.
Thank you for that. And just to say, it's a pleasure to be here. Thank you for the invitation, and I'm really looking forward to today's discussion. So as mentioned, my name's Alex. I'm currently with UNFPA. I previously worked for the Mission of Ireland and the EU delegate as policy advisors. And I think something that really comes to mind when we talk about systemic barriers or systemic barriers is exactly what you said, intersectionality. We can't look at any one issue in a vacuum, and we really need to dig down and see how different areas of discrimination kind of layer on top of each other to kind of compound these barriers and make it increasingly difficult for everyone, but particularly those, let's say, from poorer backgrounds or younger individuals to kind of climb out of that. So it's by no means an exhaustive list, but issues such as rural-urban divides, as you mentioned, geography, sexual orientation, gender inequalities, ethnicity, race, religion, they can all impact how we try to access healthcare, access education, and these other vital services. I think in the medical world, it's been well understood that women's medicine has often been overlooked in a lot of research projects, for example, those being kind of going through trials were men, which impacts how we understand that women access or how they feel the treatment differently. I think a really interesting example, and this is something that UNFPA is focusing on as we reach the 30th anniversary of the International Conference on Population and Development, is, for example, maternal mortality. There's been huge progress in reducing maternal mortality around the world since the Millennium Development Goals, but we're still seeing that in certain areas, particularly in rural areas, the ratio is still quite high, unacceptably high. For women from Afro-Caribbean backgrounds in different parts of the world, the maternal mortality ratio is still very high. So how can we kind of address that? How can we get to the roots of these issues and to understand that we need to be very conscious of how we provide healthcare services and how we engage with these populations. And I think that comes down to sensitivity when we're training healthcare workers, when we're engaging with local communities and understand who you're providing care to. I'll leave it there for the moment. But
Thank you very much, Alexandra.
All right, so I knew that UN Women and UNFPA were going to say it all. So let me just say what remains to be said, perhaps, and you almost said it, but sort of picking up on the culture of othering that is essential to marginalization. I think we experience it, we sometimes see it, but very often we don't see it. And I'll give an example of how. So when I first moved to the U.S. From Bangladesh, we had a health crisis, and I had my very supportive New Yorker friend who said, you have to demand it. You have to demand the services that you need. Nobody's going to bring it to you. And that was such a cultural shock for me, because coming from Bangladesh, is supposed to be deferential, the doctor knows best, etc. So I think that, and that comes from, that's not quite othering, but that comes from certain assumptions that you have about people who look different from you and about healthcare providers. So that's one. A second example apropos to that is I was recently in Guatemala talking to young women in a program called Abriendo Oportunidades, which has been very successful in working with indigenous communities. And one of the main things that they wanted to talk to me about is the fact that for indigenous girls and women, the doctor, the teacher, the professor is always someone who looks completely different from them. That is the main way in which my colleagues were introducing me as someone from Bangladesh who's overcome these barriers where these same divides and differences culturally don't exist. So I think there is this element of culture that permeates, that's not necessarily only true for remote rural areas, it's true in New York City. We need to be, I don't have many answers, but we need to be conscious of it.
Thank you. Thank you very much. Just to shortly summarize, we've just heard a wide range of barriers that encounter when it comes to access to healthcare systems, from geographical, economical, cultural, and so on. Yet I've also heard a good practice, even though we are from different societies and we don't know exactly what is the situation in each of the region. It's important to raise the consciousness and the awareness among people and to make them ask for their rights and to systematically push forward some actions in order to benefit from these rights. Did I get it correctly? Yeah, to try to make it also at the grass level to ask for, and they need to know that they can ask and they can do that. And what other good practices do you have in mind? Maybe you've heard about projects or you've had successful projects in the past that managed to overcome these kind of barriers. We would be more than happy to find out very shortly about this. Thank you. Please.
So just to say, it's a really good segue from what Sajida said. It's really the experience of how do you help women to demand these rights. So we have a small project that we did in Ethiopia and Uganda where over 10,000 women were empowered, women and girls, to demand discrimination-free access to services. And we did that through intergenerational dialogues. So it was bringing the leaders of the community, the traditional leadership, people who are the ones that are the gatekeepers, if you will, in communities, together with the young women, with women, to hear their issues and then understand what can be some of the ways to unblock some of these barriers. It was also done through peer support, mother-to-mother clubs, young girls doing these, coming together around different issues within communities. And it really helped them to realize that they have the rights, that they can claim the rights, that they can demand, as Sajida said, the rights for that. So I think that's been a really good experience for us. It's also that it was done within a very difficult context of refugee camps. And I think there you've also got another layer of systemic barriers that you are facing in a particularly difficult context where also you have host communities who also need access to services. So how do you manage that? I'll stop there.
Thank you very much, Nazneen, for your insights, especially about the intergenerational dialogue and how important it is to address those issues. So building upon that, I would like to ask the next question to Sajida, because you are a demographer and I have discussed with you beforehand about how those dynamics change also with the global aging population. And but in some communities there is even more youth than ever before. And where do you see the importance of this intergenerational dialogue, or do you see the importance, and maybe where can youth really make a difference to improving healthcare and eradicating poverty?
So I think it can certainly start with dialogue, but I think the idea is to raise awareness that you're young now, you're going to be old. And what are you going to do when you're old? But I think for a lot of young people in Asia, where the societies are very aware that they're aging, and there are many more older people than young people, kind of those particulars of what it means to need care as an important part of that awareness that needs to start happening when people are young. So that's one. So I think it's not so, it's almost, it can start with dialogues, but it's really kind of not having these divides. You're all part of the same system and you're building blocks of the same society is what I would say.
Thank you. And maybe as a follow-up question, where do you see the influence that prevention can play in this process? Because the percentage of finances invested in prevention are a lot less than in healthcare. So keeping people healthy is, the percentage of money invested in that part is much lower than in curing people that are already sick. So how could we change that?
So this is actually something you mentioned when we were talking about it, which is the importance of we're going to live longer, you're going to live longer, and it's not just that you'll need care when you're old, but how can you have a healthy aging so that you don't perhaps need as much care or you're not a burden to other people. So I think a lot of those habits, this is what you were saying, a lot of the habits start very young. And whether it's in terms of avoiding picking up drinking and smoking, or it's in terms of exercise and having a regimen of physicality that can help. So I think all of that you can't start early enough, right? You can probably good eating. You can you have to start at a very young age. So I think I would say that those are the notions of prevention that I would emphasize, and that doesn't just have to come from the individual. It to create, I think, as medical systems, to create platforms that encourage that. So in my own work, where we work on preventing child marriage, I'm a big believer in creating safe and supportive spaces, and by that I mean virtual as well as physical spaces, as well as social spaces that allow young people to reinforce good behavior. Not, it can also reinforce bad behavior, but basically create those structures that provide the support system. Because one of the things that I worry about in terms of trying to change individual behavior, that individuals usually do what they see others around them doing. And so I think to say that as an individual I need to change, I need to be different, is much harder than saying collectively you create a system where things start to change, and it's okay to be different, if that's what it takes.
Thank you very much. The next question is for Naznen, right? And it's a bit more a sensitive one and a complex one, and I hope you will get to it. Because when we are thinking about poor communities, we take in consideration families, from grandparents, parents, children, on and so on. And the rate that the children will manage to get out of that system, it's quite low, because they are exposed to a specific information, to limited resources, and so on. So it's a cycle. And in this case, if we want to break the cycle and to make some systematic intervention in order to improve their quality of life, their access to healthcare, and to include them in the bigger picture, how do we make sure that our interventions are sustainable and could be applied and be effective for a long term, and not only during the crisis moment?
Okay, so that's a very good question, and I think it kind of builds on what we have been discussing. One of the things I think that's really important to recognize is a multi-sectoral approach to health, because what you need to be thinking about is what are the root causes. Is it about behaviors? Is it about what you know, what you don't know? It's knowledge, information. You need to have knowledge, you have to have capacities, and you have to have opportunities. And those, if we focus on those, that will help us to have sustainable interventions. I think one thing for me stands out as UN Women, we work on many issues beyond health. So issues where you want to bring into the health conversation, issues around access to water and sanitation, hygiene. Menstrual hygiene is a huge issue for young people. Education. What are the efforts around social protection? What are the kinds of things that we need to be working together with so that we have a sustainable and transformative response to health? I think the other thing that's really important is the activism. We need to be thinking about transnational, cross-sectoral activism. So that's something that also helps to think, if you want, about how youth can come together around issues around climate. There's a huge connection between climate and sexual and reproductive health and rights. So how do we make sure that these movements are speaking to each other? That's another one. And then finally, we do need to see money and investment in strategic interventions that are sustainable. So things that we know work, we need to have better investment in there. And then my final point is to ensure that we've got voices of those who are completely impacted. So we talk about marginalized communities. Where is the space for their voice to be heard? So I think that's something, and people who are working as youth activists, but also working to support youth, we need to be creating the spaces for their voices to be heard. Thanks.
Thank you very much. And before I give the word to Flora, I just want to emphasize what you've said, and it's extremely good to keep in mind, is that even though we are currently going through overlapping crises, either when we talk about economic or climate change and so on, we need to see the bigger picture and to see that they are interacting with each other and to focus on the common points in order to be effective and to really get to the sweet point of those and to make them work. So thank you for saying that. Flora, the floor is yours.
Thank you. And I would like to also build up on that, because you mentioned the connection of climate change and SRHR, which will probably exacerbate in the coming years. And you mentioned also the sustainable investments. I feel like it's very important that we anticipate the challenges that may arise within the next few years to be able to make those sustainable investments. So my next question, building upon that, would be directed to Alex. The project that you're managing with the Lancet Commission aims to provide an overview and actionable solutions to some global health threats in the 21st century. So how does the Commission plan to approach these questions and these issues?
Great. Thank you very much for that, and some really interesting points. I'm enjoying this discussion so far. So just for maybe those of you who aren't familiar, the Lancet is one of the world's leading medical journals, and they have a number of commissions throughout the years. Lancet commissions are where Lancet editors collaborate with academics from all over the world on specific subjects. So in the past, there's been ones on adolescent health, there's been ones on climate change and health, sexual and reproductive health and rights with the Guttmacher Institute. The one I'm currently working on is looking at global threats to health throughout the 21st century. It's co-chaired by UNFPA's Executive Director, Natalia Kanem, alongside Dr. Chris Murray, who leads the University of Washington's Institute for Health Metrics and Evaluation. So it's essentially born from the understanding that we're kind of constantly living through a number of risks to our health. We've just gone through COVID-19. We've seen what happens when, there's global war. And there's also an understanding of what else might be out there. We're already starting to see the impacts of climate change on health. What risks do technology pose, for example, to our health over the next century? That all sounds a little bit terrifying, but realistically, what this commission aims to do is be forward-thinking, to future-proof, and to find solutions to some of these grand problems. So the approach of this commission is essentially led by our ED and Dr. Chris Murray. They've gathered over 30 experts in global health and governance from around the world. It's a really amazing group of individuals. There's gender parity, there's youth voices and representatives, and every region of the world is represented. And it's a 2-year process whereby we bring that group together in a series of meetings to kind of drill down across a number of areas that could pose risks, kind of do preliminary research on it and discuss its kind of merits and the I guess the idea of will it expand in this coming century. And then the main focus is what are the solutions, what are the steps we could put in place to prevent that from happening, and quantifying it and understanding that risk. So it will culminate in a final report towards the end of this year, early next year, and kind of maybe some other products coming from that. So I'll leave it there. But if you have any follow-up questions, let me know.
Thank you very much for this fruitful insights. And we are very curious now to move to the room and to the online participants to see and to open the discussion. So we are currently inviting the people joining online to get back to menti.com and to use again the code. I'm not going to re-say it because I need to change my glasses. And we are kindly asking you to add your questions there. And meanwhile, we are inviting the participants here in the room to contribute, to ask questions, to directly interact with our distinguished experts from today. Please. Yes.
Okay, I think it's working. Thank you for the discussion. It's really interesting. My question is maybe turning into a different aspect. So we've talked about like healthcare issues concerning women. My question to like the whole panel, I guess, is then what are the things and the steps that we need to focus on, like male identifying members of society, and what programs of outreach to them in how they respond to women's like healthcare issues should there be, or how should we like target that particular group of society so it's more accommodating in instances where it's more privileged to access those healthcare benefits, or that doesn't have some of those issues that you mentioned today. Thank you.
Could you just quickly mention your name and your affiliation?
Yeah, so my name is Christopher. I'm the UN Youth Delegate of Latvia. So nice to meet you all.
I'd like to go first from the panelists.
I feel like I keep taking the mic first. It's just that I really liked that question and very grateful for hearing that. And I just wanted to share an example because I think this is something that's really important, is how do you build allyship? And for us at UN Women, that's really important. We can't do this alone, and you can't expect to change and transform gender norms by just working with women. So it's really important to have men engaging. And one example we have is we have this platform called He for She, where we work with men to bring in men to help us to address gender inequality. And we did some work in South Africa, Malawi, and Zimbabwe, where we conducted these dialogues to transform health-seeking behavior amongst men and women. And in this case, it was focused on HIV prevention. And what was really good is by doing discussions around why are these inequalities there? Why can't women seek out health services? What are the challenges? And to hear from the men also, because we also heard from men that they also have challenges seeking out services because they're working. And by the time they finish working, the clinics are closed. So they need to be able to go to a clinic when it's available and open when they're available. They also need to understand how it's not a sign of weakness if they have to seek out healthcare. Whereas in a case with women, it tends to be very automatic when they're the ones who are having children and their reproductive health is very significant as a priority. So through these dialogues, it turned out that there was such an interest in understanding what to do differently that we saw an uptake of increased access to HIV testing by 50%. And it was 50% more amongst men than women. So I would like to say that I think having dialogue and discussion around inequalities, around issues that men also face in seeking health, is a good solution to try and address some of the challenges that men face. Thanks.
Very much for that comprehensive answer. Do we have a second panelist who would like to share insights? Yes, Sajida, you have the word.
Yeah, so I think quite apart from kind of programs that address men's participation, I think one of the issues that some of these programs do is they very specifically make it safer for addressing masculinity, changes in behaviors that are not a threat to masculinity or people's notions of masculinity. And I find that there's a very strong link. Haven't done any work on it, but I feel like there's a very strong link between men's mental health and these notions of masculinity that, for their own sake, as well as for the sake of their relationships, one needs to address.
Very much for these insights. And I saw a question from the online participants. I think it was question 3, this one, question 4, that is related to the stereotypes around mental health. And I wanted to ask you if you know any examples or initiatives or general ways in which they can be addressed, especially for young people who are mostly students or also in different communities where it can be, life can be hard sometimes as a young person. And how can those stereotypes be changed?
I have kind of just a few different ideas that I bring back to every question. But one of them is this whole notion of creating a safe space. We have at the Population Council, we have this program called Berania 1, which was addressing child marriage, but it was working with men for them to, and basically promoting the idea that it's okay to change, but kind of working off the assumption that most people in the community are going to kind of start subscribing to a new kind of behavior. I think it's that kind of a notion that addresses both the issues of stereotypes and how you break them, but it sort of empowers men, and I think it applies to any group that is homogenous, that it sort of gives the support system which would otherwise be very difficult to change in terms of their own well-being.
Do we have other questions in the room? Feel free to raise your hand. Yes, and please mention your name and affiliation.
Hello, Jane McCall-Politi, the Federation of American Women's Clubs Overseas and the NGO Committee on Migration. I'm co-chair of the subcommittee on children and migration. So when I know this is a youth group, but children are growing up very quickly. And when we talk about prevention and creating a safe space, there are wonderful programs, and there can be wonderful programs of early childhood education and care, where these things can be realized, where you have a dialogue also with the caregivers, the parents. It's peace building. It creates good habits. It can create good habits, and it can break xenophobia, stereotypic behavior. It can create an intercultural space. And you were talking about the importance of people being able to be reflected in the providers. Yesterday, we had a panel, and there was Sherry Weston from the Sesame Workshop was talking about a program in Bangladesh where 2 of the Muppets are actually Rohingya children. And it just made a whole world of difference in the way the mental health is also being treated. So I just wanted to mention this because I believe in the children need to be supported in the families too, especially in migration contexts. Thank you.
I'll mention that to my sister. She runs Sesame Workshop in Bangladesh. She'd love to hear that.
Thank you very much for sharing these insights. Do we have further questions in the room? Yes.
Hi, everyone. This is working, right? Hi, everyone. My name is Cecilia Schurmeister. I'm here with the Baha'i International Community. And I have a question for the panelists. I also just wanted to comment on what you said, though. I appreciated that question since we're talking here about women and girls. And I was just thinking about how we're talking about health and the question about empowering all segments of society to work for the well-being of any one group, such as women and girls. I think about like the human body and how if we want a fully functioning, healthy, flourishing human body, every organ of the human body has to work well with all the other organs. Like if any one segment is to be healthy, if the whole body is to be healthy, then all organs of the body have to be healthy, and it's the same way in society. Like if any segment of society and society as a whole is to advance, then all segments of society have to be enabled to advance together and serve that. But now, going to the panelists, I just wanted to ask about the role of community. I saw on the virtual, the screen where we were kind of getting the insights from all of the participants, and community came up there, and I was just wondering kind of what we think of as the role of communities and, as you mentioned, intergenerational wisdom. I was thinking about how different regions, the different cultural contexts that have their own cultural perception of medicine and health and well-being, and how that can also is such a valuable part of different regions of the world in combating poverty, but also just improving general well-being of a community, and how those segments of those aspects of health are so important. So since we're kind of having that higher level system of healthcare, access to healthcare question, I also just wanted to hear your thoughts about the role of community in accessing health from that perspective. Thank you.
I'll kick us off, but I'm excited to hear maybe from some additional perspectives. But I think, firstly, thank you so much for your question. I think it's really important that when we're talking about these global issues, that we don't forget the micro level as well, that we realize that there's a whole ecosystem from the individual to the household to the community and beyond, where we need to consider factors of this. I think something that I've seen in my studies, and also while I was with the International Labour Organization, I worked on a health worker project. And I think that one of the biggest examples that stands out to me is what change can happen when you invest in healthcare at the community level. I think the community health worker programs that have really come to the fore in the last few decades, I'm thinking in particular of Ethiopia with the health extension worker program there, really kind of gets health to the doorstep of so many more people. They promote kind of leadership and advocacy within communities. They have the power to empower a lot of women. A lot of women fill these roles and kind of promote a whole new generation of health and well-being, and kind of changing many of the systemic barriers that we were mentioning before, because when you raise the health of a community, you also help lift people out of poverty, you improve their kind of health literacy and education and other matters like that. So that was something that was coming to my mind, but I would like to pass over to my other panelists.
So I'll jump in just to say that I fully agree with that. And I just wanted to add one additional dimension, and that is to make sure that we are fully resourcing those community health workers, because we find oftentimes that these are all voluntary actions that people will do in the community in order to support each other. So we need to make sure also that when we're talking about health extension workers, that they're fully paid, they're recognized as key agents of change within the health sector. So I fully agree with that. The other thing I think that's really important is community organizing as well. We've noticed in the work that we do as UN Women that the way that women's organizations come together at the community and local level influences how that community's growth will happen. So whether it's political engagement, whether it's with local level government, whether it's in the health sector, whether it's in the education sector, it's the communities that actually roll their sleeves up, sit down and hammer things out, and then as a group advocate with leadership. So I think there's something to be said about investing actually in that kind of organizing. And we've seen that in all over the world, is how that community organizing can achieve results. So I think that's a very important dimension to how important communities are. Thanks.
This is it's close to my heart. So one of the things, yes, just building on both those points, one of the things that I find very compelling, and I think there is very good evidence, is the connection between the community and the individual or the household. The connection between the home and the world. I think in Bangladesh we had very tremendous success in family planning program, child mortality, and the key element to my mind that doesn't get enough attention is we deployed 60,000 family planning workers who went to the homes of women. And I think it's breaking that divide between the home and the world. And this is, of course, a very literary interpretation for those of who you might know the Tagore in the Bengali literature, where one of his seminal works is called Home and the World, and then Amartya Sen picked that up and titled his biography as At Home in the World. And I think that's really critical, is for women in particular, but I think also for men, it's the reverse. Men are always in the world and never in the home, and women are in the home and not able to get out into the world. At least in South Asia, that is kind of a pretty fundamental social problem. So I think this sort of breaking barriers between the different ecological spheres that we inhabit is really important. Sorry.
Also for complementing each other so well in your answers and bringing those different dimensions really into the package. I saw a question that would, exactly this one, by the Association for Youth Wellbeing, that sort of fits into this context very well. So what does creating an accountability framework look like in the context of accessible healthcare in the Global South? And yeah, maybe Sajida is the person to answer, or maybe someone else would like to share their insights as well.
I will try. I'm not quite sure that there are many successful examples, but I think on the notion of accountability, one of the things that I think can be really powerful is frameworks of law around access to information, holding communities responsible. So we tried to apply it, not with very good success, to basically looking at community budgeting and saying what was going where in terms of in the community. But making visible what the investments are and what people are doing with collective resources, I think, is a really important way to go. And a very important part of that is the right to information that you can hold communities accountable with.
Thank you very much. And I've also seen another question regarding how can young people use what you've mentioned and the good practices in order to get involved. And before I give the word to you, I'd like to say something from the perspective of a young person. And indeed, it's a responsibility also on us to work, to get involved, and to start working at the grass level, because I think there are experts and organizations in our communities that are already doing a great work. Let's get in touch with them. In case there aren't I think it's time for us to create them and to start working. And the key point for everything is to find our passion, to see what we are passionate about, whether it's about improving the healthcare systems or reducing the poverty or contributing to the climate change and to reduce pollution and to create sustainable methods, anything. I think we can find something that we are passionate about and get in contact with experts, because we come with the creativity, a fresh mind, new ideas, but we also need the framework of an expert that already has knowledge, already has gone through some failures, and can teach us how we can be more effective and to reduce the time that is spent on finding the proper solution. So after I say this, I'm looking forward to hear also what are your perspectives on youth and what we can actually do, and if you can complete something that I've also on what I've said. Thank you.
Great question, and thank you for sharing that and kind of setting the scene up. So I think a lot of what we were talking about with community, with grassroots, is a really interesting way to go. I think if we want to talk about poverty eradication, if we want to talk about healthcare promotion and promoting well-being, I think we need to maybe break down the silos a little bit and really reach areas where maybe you don't immediately think of going for the first time. For example, with youth delegates, I know many of them kind of work through their Ministry of Foreign Affairs, but if you're interested in exploring areas around mental health for youth, engage with your Ministry of Health and go kind of through those systems in terms of, is there a regional health board or a community health center that you could be approaching to engage with on, a mental health course for young people, or information around sexual and reproductive health. I think that's kind of a way to kind of get started at the grassroots level, maybe have an exercise in thinking macro and then bringing it down, or vice versa, and trying to explore how you can go beyond that.
Thank you.
So those are perfectly exactly what I was thinking we need to go, but I'd like to add a couple of things. I think one thing is to continue to feel empowered to challenge what you see in front of you and what you don't agree with. I think that's the value of the freshness that you speak about when it comes to youth and youth engagement. This event and this session has been so interesting for us because it's really about hearing your thoughts about where we need to be driving attention. So empower, question, challenge. I think the other thing that's really important that I have valued working with young women is they are very cognizant of diversity amongst youth. And this intersectional lens that we speak of is so ingrained that it's not necessarily something that you need to be teaching. So it's about how do you harness that more and how do you value that more. And then this youth delegates is such a fantastic opportunity. And how do you share your good experiences as youth delegates with other countries? So eventually we will have every country have a youth delegate on their delegation for all of the different conferences, not just this one, for the CSW, for, when the General Assembly meets. So I think these kinds of strategies are really, really helpful to keep the momentum going. Thanks.
Yes.
I think, so we've talked about a lot of the effort in being delegates go into understanding or learning the behaviors that are expected of you in these adult spaces. But I think an equally important one, and one that I heard when we were doing some work with Guatemalan girls, is the real transformative change is when they can they can find their voice and they can place their voice, which is a separate endeavor altogether. It's not so much, and the part about placing it in the right context is important. But that notion of voice and knowing yourself, I think, is really key.
Thank you very much for these really important contributions. And I think that, there are different levels at which youth can have an impact. Yes, there are youth delegates, and we are not the only youth delegates who are advocating for a more universal, coverage through UN youth delegates at those conferences to really come with the voice of global youth and not just a few countries. But this doesn't mean that youth in general cannot contribute at really various levels, and we see great initiatives. In the preparation of this event, we've had around 15 video contributions that you will see also after this event displayed here, from really youth around the world who have founded associations to promote healthcare or specific areas of mental health or SRHR in their communities. And these are really important initiatives that do make a difference at those different places and also different levels. And I find this really interesting because it goes back to what has been said previously, that the community but also the intergenerational dialogue and this whole ecosystem is really important, that individuals and communities can really live their human rights to well-being. And I briefly want to mention here that, and actually, that Anna Maria also founded her company with the intent, as I understood it, of improving this health literacy within her community. And I think this is one example of a really important initiative, and I really encourage people to use their ideas, to use their creativity and their young spirit to do similar initiatives.
Exactly, and to work on together, because we need to look for the resources that we have in our communities, whether we talk about experts, organizations, ministries, people. There is at least somebody who will be open to hear our ideas. So I totally encourage you, all of you, to go forward and to keep on pushing, because this is the only way to move forward. And before closing, we do make sure that after this event, we will be working on a short brochure in which we will try to conclude everything that has been said today. And also maybe we will try to come up with some directions and guidance and responses to the questions that have been mentioned online. And we thank you for the contributions for the people that joined online today also. And we will definitely make sure that we stay in touch and we will hear from each other after this event. And we cannot wait to see all the initiatives, and maybe, why not, to do something together. And I give the word to Flora now. Thank you so much.
Thank you so much, Anna Maria, for these kind words and summarizing and giving us a way forward out of this event. And I really encourage you, if you haven't registered for the event, to still do so, that we have your email addresses and that you will receive the follow-up document out of this event. And with that, I would like to express my gratitude and thank yous to the panelists, to the co-organizers, to the sponsors, and to the public in person and online for your interest, for your contributions. And yeah, we hope that youth can make a change. So with that, I wish you great continuation of your conferences and see you around.